My name is Bradley End, and this is the language of transducer manipulation, codifying terms for effective teaching 2.0, a preliminary analysis. I've retained our original title slide. I'm currently affiliated with the West Virginia University Department of Emergency Medicine, as is my co-investigator, Dr. Joseph Minardi. We're also working with Dr. David Boehner, who's affiliated with the Ohio State University Department of Emergency Medicine. As an introduction to probe movements, the AIUM Technical Bulletin published in 1999 titled Transducer Manipulation defined 5 common probe motions, which they defined as sliding, rocking, rotating, tilting, and compression. This was further clarified and applied to echocardiography in 2005. In regards to point-of-care ultrasound specific to emergency medicine, many of our medical students and residents use the Manual of Emergency Ultrasound, which was published in 2007 by Drs. Noble and Nelson. In this text, they described 3 common probe motions as tilting or fanning, angling, and rolling/twisting. Later on in 2016, Dr. Boehner and his colleagues at The Ohio State University published a report on the language of transducer manipulation, where they went on to qualify 6 common probe motions, which they labeled rocking, fanning, sweeping, sliding, rotating, and compressing or using pressure. The terminology used by Dr. Boehner and his colleagues is all relative to the angle of incidence or the degree of incident angle of the target structure. Here are text graphics depicting the common probe motions which they described. In order to better understand the terms used by sonographers and physicians in the field, we developed a survey instrument which had a video demonstration of the 6 cardinal probe motions. In addition to this, we collected educational and demographic data using the Qualtrics software. This was distributed using a modified convenience sampling and snowball sampling. It was distributed on ultrasound listservs, through social media, and various foam med resources. There was periodic redistribution in no more than weekly intervals, and the initial survey window encompassed 6 weeks from February to April 2019. We had a total of 419 respondents. Of these, 65% or 269 were sonographers, and 34% identified themselves as physicians. We did have 1 advanced practice provider also respond to the survey. In regards to physician response, 83% of physician respondents listed their primary specialty as emergency medicine. We did have a sampling from various specialties, including critical care, pediatrics, family medicine, and rheumatology. It was noted that 35 physicians did not provide their primary field of training. As far as regional data, the majority of responses came from the South. For the results section, we originally intended for audience interaction. However, given limitations of the current media, we will display the probe motion clips, which were included in the original survey, followed by the breakdown of responses from physicians and sonographers. Here we have our first probe motion. As you can see, the majority of physicians referred to this probe movement as fanning, while the majority of sonographers referred to this probe movement as sweeping. Here we have our second probe motion. The majority of sonographers referred to this movement as heel toeing, while physicians referred to this movement as rocking. Here we have probe motion 3. Both the majority of physicians and sonographers agreed that this probe movement could be called a slide. Here we have the 4th probe movement. There is no clear consensus among sonographers as to the terminology to be used for this particular movement, while the majority of physicians describe this as compression. Here is the fifth probe movement. The vast majority of physicians referred to this motion as rotation. There was more division among sonographers, with a near majority calling this motion rotation as well. And here's our sixth probe movement. Both the majority of sonographers and physicians labeled this particular movement a slide. One of the included questions in the survey instrument was whether or not inconsistent probe motion terminology makes teaching ultrasound more difficult. As you can see, the vast majority of both sonographers and physicians either agree or strongly agree that having inconsistent probe motion terminology does make teaching ultrasound more difficult. We thought it would be interesting to see which probe motions are referred to most differently by physicians versus sonographers. The first included movement with a discrepancy was the movement depicted below, which is motion of the short axis of the probe along a fixed point on the body while changing the angle of inclination away from 90 degrees. 85% of physicians refer to this movement as fanning, while the majority of sonographers refer to this movement as sweeping. Another movement in which we saw significant discrepancy was motion in the long axis of the probe along a fixed point on the body while changing the angle of inclination away from 90 degrees. The majority of physicians refer to this movement as rocking, while the majority of sonographers refer to this movement as heel toeing. A third motion in which we saw a significant discrepancy in physician and sonography responses was movement around the compression axis in a clockwise or counterclockwise direction. The vast majority of physicians referred to this movement as rotation, and while a near majority of sonographers referred to this as rotation, it was clear there was no consensus among sonographers as to what this motion should be called. In conclusion, after a review of the data, it became apparent that there is no clear consensus in regards to universal nomenclature for cardinal probe motions. The preliminary analysis demonstrated that there is differences in sonography terms and physician terms for various probe motions, though differences exist within those groups as well. When the data was broken down into further subgroup analysis, including the age of respondents, the years of experience of the respondents, or the region of training of the respondents, there was no clear variation of probe motion terminology. And, overall, both physicians and sonographers agree that the lack of cohesive lexicon makes teaching ultrasound more difficult. This study does, of course, have a number of limitations. All the results presented here were from the preliminary data set over the initial 6-week collection phase. There was a small sample size and low initial survey response rate, and we did have to use a modified convenience sample methodology with snowball sampling. There was a lack of physician-respondent diversity. As we stated before, the majority of respondents in the physician subgroup were predominantly EM trained, and that may skew some of the data. And there was also a skewed regional response rate with an increased response rate from the south and less from the west. We also did not get a significant response from our international colleagues, who may have different terminology for the probe motions which we've laid forward. Looking forward on how we can improve our data set, we want to increase our response rate by opening the survey for an additional 6-week period, and we hope to increase the distribution and response rates using the modified snowball technique with a targeted effort to reach some of our international colleagues and those in less represented areas on our original survey. Here are some references, and that's the end of our presentation. If you have any questions, concerns, comments, or quandaries, please feel free to contact me at bradley.end@hsc.wvu.edu. Thank you very much for your time.